What is a root canal, and why would someone need one?
To describe what a root canal is, I'll go over the anatomy of a tooth. So teeth contain roots, and within these roots, there's a canal system. So within the canal system, we have pulp tissue. So pulp tissue is comprised of blood vessels and nerves. So when this area, the pulp, gets inflamed or infected, that's when a root canal is needed. So what we do is we clean out the pulp tissue, we disinfect it, and then we seal it, and this helps prevent future infection.
What signs or symptoms may indicate that I need a root canal?
So it can vary depending on the reason the root canal is indicated. But typically what we see is we see pain that happens spontaneously. So even if you're not eating or drinking something, you may have pain on biting. And sometimes you may even have some swelling adjacent to the teeth.
Is a root canal painful?
So that's a common misconception actually. So root canals are great for helping relieve pain. So during a root canal procedure, we always give profound anesthesia. So we make the area as numb as possible so that we try to minimize any discomfort or pain. So most of the time, it actually ends up being a similar experience to just a typical filling.
How long does a root canal procedure take?
So that can vary depending on the tooth. Some teeth, like the molar teeth or the premolars in the back, they have more roots, which means that they have more canals, which means that the alignments usually take a little longer to clean and shape and disinfect every canal. Whereas the front teeth, usually they have only one canal, so that tends to go by a little quicker. You'll probably get it done within an hour. Sometimes for the back teeth, it may take 1 or 2 appointments, really depending on the complexity of the case.
What happens after a root canal? Will I need a crown?
So again, that's on a case-by-case basis. So we will try to look at the big picture, see the condition of the tooth before we recommend a crown or not. Typically, if the root canal is caused by a crack or a large cavity, we do recommend a crown to ensure or to allow for the best success for the tooth. Because what a root canal procedure does is it does make the roots a little bit more brittle. So the tooth is more prone to fracture. A crown helps protect the crown of the tooth and thereby reducing the risk of fracture.
What does recovery look like, and how long does it take?
So recovery is pretty simple for a root canal. Most of the times patients only have mild discomfort after the procedure, which typically goes away within a few days. We just generally advocate trying not to chew or bite anything hard on that side until we can get a final restoration, whether that be a permanent filling or a crown. But most of any discomfort that does arise can typically be managed with just over-the-counter pain medications like Advil or Tylenol.
What happens if I delay or avoid getting a root canal?
So if you delay a root canal, what can happen is that the infection can actually cause necrosis or the pulp tissue to die. If this happens, then the infection can actually spread to other areas of the mouth. At first, it may just be a localized swelling, but it can turn into a life-threatening situation if left untreated for a long time. So we always advocate getting infections treated early, whether that be a root canal or even a simple filling.
Are there alternatives to a root canal?
So we always look at every option possible when trying to determine what the best course of treatment is. Typically, though, if a tooth is at the point where it needs a root canal, unfortunately, a simple filling just doesn't cut it anymore. So usually if the option is a root canal, the only alternative is taking the tooth out, right? So we always use our best judgment to see what the best course of action would be for each tooth, and then we provide you with our recommendations.
How long have you been performing root canals?
So I've been performing root canals for about 3 years since I've graduated now, but even at school, I was performing root canals. So at this point, I've gained a lot of experience and I am pretty confident in my abilities to successfully treat a tooth that needs a root canal.
Do you use any special technology to make root canals more comfortable?
So we do offer sedation to our patients. So we do offer nitrous oxide and oral sedation. So patients who are a little bit anxious about the procedure or just, want it to be over sooner than later, these are great options because they can get you more relaxed and make the procedure a lot more comfortable.